Welcome back. We're here with Dr. Desai on a really cool topic that a lot of people don't know about because they probably haven't even heard about it, but gum recession.
That's right.
And I know my aunt had that done a long time ago, about 15, 20 years ago now, and things have definitely changed.
Definitely technology and finessing of techniques and research has improved everything.
And how it's done and stuff, right? I guess it's not, it was probably more painful back in the day when they weren't so sure of how to get that done, but...
I think so.
Is it become a lot more common now as well?
You know, gum recession is something that everyone experiences at some point in their lives, I feel.
Okay.
Because I see the worst cases, of course, but I also see cases that are diagnosed early. So when things are caught early, of course, it's easier to treat, less painful, less traumatic, and also more successful.
Yeah. We have some myths here, too, that people might not know, but they say once it's gone, it's gone. Is that true or false?
I think when it's gone, but you can get it back again.
You can?
Yes.
What's the #1 cause of it, then?
There's a number of causes.
Okay.
I think it's a bit of a misnomer as well that toothbrushing and scrubbing gums away is the primary cause, and that's not true. That plays a role in some people. It could be that people are just born with actually very thin gums in certain areas of their mouth. Orthodontics and braces can stress the gums out as well. Clenching and grinding, which everybody does.
Really? That can cause recession?
It can cause recession.
Wow.
Yeah. And aggravate even a condition that's already started. It can just get worse.
Yeah.
So there's lots of causes.
Wow.
Yeah.
And so what about, it's a gum disease. Is it a gum disease?
Well, disease means a pathologic condition. So by definition, yes, but it is not a bacterial origin.
Okay.
Gum disease we have in our mind as a pocketing, pus infection. Gum disease can cause gum recession in some cases, but the two are not the same.
It's not related, really. Yeah. And so they're talking about the shallow pockets here. So what does that mean, like 1S, 2S, for people that don't really understand it? So what are the pockets about for gum recession?
Pocket recession is measured in millimeters. And so 1 millimeter, 2 millimeters, 3 millimeters, like on a ruler, is the measure that we use in the dental environment to measure how much recession is going on.
So is there some that is, like, if you just have a bit of recession, do you guys still take a look at that and try and figure it out right away? Or is there some circumstances where if it's just a bit, you kind of leave it?
That's the ideal, exactly. So for example, on the screen here, we have some photos on the left where gum recession had occurred, and the second photo is gum recession was treated. Okay. So the more shallow the recession, the earliest possible time you can diagnose it is the best treatment, that you can get full coverage of the tooth. For example, on the lower, on the right photos, you have gum recession, which has occurred over the years and really thin gums. It was referred to late, so all you can do is then just thicken up the gums to stop it from getting worse. You can't necessarily get full regeneration.
And what are the treatments available then for gum recession?
It is a procedure called gum grafting, and gum grafting is where you take gum graft tissue, whether it's from your own mouth or a package of donor tissue, and put it in the area that needs regeneration.
Oh, that's
as simple as that.
It's that easy.
Yeah.
And is the recovery time quite quickly, or is it a longer recovery time?
Within days, you go back to your regular routine. You may be on a softer diet, common sense kind of thing, but that's very short.
Most teeth work is like that anyway.
Exactly, exactly.
All right, any other info we missed out for treatment or just being aware of gum recession?
I think being conscious of what's going on in your mouth, asking the right questions, getting a referral earlier rather than later makes a huge difference, and being proactive and you know, just taking care of yourself.
Visiting your dentist.
And visiting your dentist and hygienist.
All the info on the screen for you on how to get a hold of Dr. Desai. Thanks so much for coming in.
My pleasure, Steph.
We'll be back right after this.